If you haven't done so, turn off your cameras and to mute yourself. Feel free to put any questions on the chat. Khaled will be reading up any questions, and no need to wait until the end necessarily. We can answer it as we go, if that's okay. That with everyone. So yeah, I think we're gonna start the recording now and we can get started. So again, like my name is Thomas. I'm not a person living with HIV, so I want to disclose that as well. So when I'm speaking about these experiences around PrEP and around the LGBTQ+ community, I'm speaking about my experience professionally, but also my personal experience as a queer person. So that's kind of the baggage that I'm carrying, and most of my work has been around harm reduction and anti-oppression. And I'm really excited to talk to you about PrEP today, and we hope to answer any questions that you have by the end of the presentation. But to get started, some information for us to kind of understand the context that we're speaking about is that there exist and there are some populations that are at higher risk for HIV. So those populations that were named here for gay, bisexual, and other men who have sex with men, people who use drugs that are at higher risk for HIV and STIs, trans and non-binary communities, immigrants, newcomers, and settlers, communities that are African, Caribbean, and Black, and First Nations, Métis, Inuit, and other indigenous communities. So what can we gather from all of those communities that are disproportionately impacted by HIV and STIs, right? All of them have some form of history of oppression, you know? All of them have undergone being made invisible. All of them have undergone some level of colonialism or some level of power imbalance that makes it such that they have less access to healthcare. Now, we know that a lot of LGBTQ2S+ community members have had negative experience with healthcare. We know a lot of racialized, Black, Brown, Indigenous people have had negative experiences with healthcare. So really, it's unfortunate that we're in a position like that, right? But the history and the oppression that those communities have undergone have really caused it to have different levels of education about HIV and STIs, different forms of access to prevention methods like HIV, PrEP. And just to give an example, right, like the HIV education that we have been receiving and that we've been seeing for the past decades has really been focused on one population, which is gay, white, cisgender men who have sex with men. A lot of the education and information about HIV has revolved around that population. So really, I think it's important for us to understand that there are many different populations impacted by HIV and that PrEP can be an option for a lot of those populations. But due to many political and social contexts, it has been perceived almost as a gay-only thing, right? As a gay-only drug, making it so that it becomes less accessible and less visible for other populations. So kind of to begin things off and to start everything, what is PrEP? You know, PrEP stands for pre-exposure prophylaxis. And technically there can be many different kinds of PrEP, right? There can be pre-exposure prophylaxis for different infections and diseases. But specifically, we're talking about HIV PrEP, which is something that you take if you are HIV negative and in advance of a possible exposure of HIV in order to prevent HIV infection. So I like to compare PrEP really easily to birth control, right? Because birth control is something that is related to your sexual wellness, your sexual health, and is related to your behavior too. So ahead of being pregnant, folks that are at higher risk of being pregnant have the option of taking birth control. So now we have something really similar, but for HIV. And it's really similar and it works really well as well. So a lot of studies have been done with PrEP, testing it out, right, with different populations. Unfortunately, most of the studies have focused on men and have sex with men, making it so that, you know, it kind of continues to feed that cycle. But it works really well. And it works around 99% of the time when it's taken as prescribed. So really, what is in that pill? It's two components, and the components are actually taken from HIV medication. They're part of some HIV treatments, and they are very complicated to pronounce, but it's enalapril, diproxil fumarate, and emtricitabine. So those are components, again, part of HIV treatment, but that when we isolate them, they become PrEP. And it makes it so that you cannot get HIV if you're taking PrEP as you prescribed. It really is efficient at preventing it. Now, there's different ways of taking it. Most of the providers and most of the doctors, they prescribe PrEP daily for people to take on a daily basis. So you would take one pill every day. It's recommended to take at the same time, together possibly with a meal or something that you do every day so that you don't forget. However, most people may have heard about something called intermittent PrEP, 2-on-1 PrEP, event-based PrEP, or on-demand PrEP. So that is really a way of taking PrEP that, although is not prescribed very often by providers and clinicians, some people choose to take it for that event and on-demand based regimen, which would be taking 2 pills 2 to 24 hours before sex or any exposure that you're having to HIV, and then taking 2 pills for 2 days, once a day after that. So you'll still be taking kind of 4 PrEP pills per week, which is within the threshold of efficacy. Of course, the efficacy of this one is a little bit lower because you're not taking it every day. But I just wanted to touch on it because I know a lot of people have heard about those ways of taking PrEP, even though it's more commonly prescribed daily. And something that a lot of folks, and there's a lot of chat about, is PrEP and STIs, right? Like, how does PrEP relate with STIs? PrEP is a prevention method that all works to prevent only HIV. So when we're speaking about that, when we're speaking about PrEP to folks, whether as service providers or clinicians or anyone just educating around PrEP, we have to understand it as part of the prevention, right? We have so many tools to prevent HIV and STIs, and we have to use a lot of them at the same time, and what we call combination prevention. So we have education about sexual health and wellness, right? Which should happen in a good and comprehensive way in junior high, in high school. People should learn about consent. That stuff is really important. We have condom distribution, right? And understanding. So making condoms accessible for everyone and making them cheap. We have harm reduction strategies. So, needle distribution and exchange sites so that folks can access their drugs through clean and new needles rather than having to reuse them. There's post-exposure prophylaxis, which is something that you take shortly after being exposed to HIV to prevent it. And there's HIV treatment. Nowadays, people who have HIV and who are living with HIV and who are on treatment cannot transmit the virus. So again, PrEP is one of those, right? I think a lot of criticism comes from the fact that it doesn't prevent STIs, but we're not encouraging people to use PrEP by itself. PrEP it's an additional layer of prevention. It's an additional layer of protection against HIV that is to be used alongside different prevention methods. So that's why it's really important for folks on PrEP to keep on getting tested as part of their PrEP regimen so that any STIs that are popping up, we are really kind of screening them and treating them as soon as we can. That is a little bit of the basic kind of what about PrEP, what it is, and we're going to go a little bit more in depth. But again, if you have any questions around anything so far and you'd like us to explain something else a little bit more, feel free to post it in the chat and we can get through that. So how does it work, right? We can understand what it is, but how does it really work inside the body? And I'm no biologist, I'm no infectious disease doctor. My background is in sociology, harm reduction, and anti-oppression work. So that biology stuff, really, I don't know much about, but I think I know enough to explain kind of how it works. But if we think about PrEP and compare it to condoms, a condom is a physical barrier, right? It's a physical way to stop any form of HIV transmission or STIs or any fluids that you come in contact with that may carry those. PrEP is not something physical. PrEP is something chemical. So it's a safe chemical, of course, that works by building a shield in your body, if we think about it like that, right? So somebody needs to be on PrEP for a certain amount of time for the shield to grow stronger. And that amount of time is determined by your sexual behavior. So if you're having anal sex, it takes about 7 days of being on PrEP. If you're having vaginal or frontal sex, it takes about 20 to 21 days of being on PrEP so that the shield is strong enough to prevent HIV. So again, comparing it to the condom, right? The condom is a physical barrier that prevents contact with any of those fluids, whereas PrEP, although those fluids may enter our body, when the shield is strong enough, the components in PrEP make it such that the virus cannot replicate in the body. So the HIV virus, because of PrEP not being able to replicate, it just dies out. So somebody would not become HIV positive when they're on PrEP and taking it adequately, because the chemical shield prevents HIV from multiplying and reproducing in the body, and therefore the virus dies and someone stays HIV negative. So there's a lot of stuff like how long do you have to take PrEP for, do you have to take it daily? But there's recent studies from the Center for Disease Control in the US too that really speak to the fact that at least taking PrEP 4 days a week can be very efficient nonetheless. Again, it's still recommended for daily usage, but there's been studies showing that even 4 days a week carries some efficiency. Again, any questions? Feel free to, I know we might be going through some of this stuff pretty quick, but feel free to pop in the chat. So who should consider PrEP? There's a lot of people who may be perfect candidates for PrEP, and there's a lot of people who may not be. PrEP is not for everyone, and it's not for the same person for their whole life, you know? Let's give some examples just in the photo so that you know this is me and my partner, Max. Aren't we cute? But we are, let's say, I always like to use myself as an example because it just mimics kind of how people would think. So let's say I'm thinking about being on PrEP, and my partner and I are currently in an open relationship, and we use condoms a lot of the time, but sometimes we slip up. You know, some people may have more difficulty, some people may be high. So at some point in our life, if we are at this higher risk of HIV, we may be considering PrEP. I may be considering PrEP. If I'm single and just hooking up and I try to use condoms and sometimes it doesn't work, or I just feel like I need an additional layer of prevention, PrEP may be good for me at that point. However, if, for example, Barry, if, for example, let's say the couple is monogamous, you know, or somebody gets married or somebody finds somebody and they're monogamous and they are pretty consistent with their condom usage, or let's say that it's a couple and one of them is HIV positive and on treatment, so they can't transmit. At that point of their life, that person may decide that PrEP is no longer for them, or if they're just not having sex. So really, somebody may choose to be on PrEP at different points of their life. Somebody may just decide that PrEP's not for them. They're happy with condoms. They're happy with HIV treatment. So just to highlight that people have different stories for being on PrEP, you know, and it's up to us to understand what that means for that person. You know, some ways that we often forget is that, like, let's say people in intimate partner violence situations that have less agency over their own sexual health may find PrEP to be an extremely good alternative. Some people that are sex workers, for example, may find PrEP to be an excellent alternative as additional layers of prevention. But when you are getting assessed, you know, it's a decision that you make between you and a healthcare provider. They will ask you a couple of things. So they'll be asking you about your sexual history, what kind of sex you're having, who you're having that sex with, and what's in between. So if you're using any prevention methods, if you're use condoms consistently, if you know the HIV status of your partner. So really they're going to try to assess your HIV risk and how well suited of a candidate for PrEP you are. Any questions so far in terms of who PrEP can be for? Just to give you an example, the Canadian guidelines recommend PrEP for, and Alberta ones as well, for men who have sex with men, trans women, and gender diverse people. Usually the qualification is that they have had receptive or just condomless sex in the past 6 months, and that they are engaging in relationships with a higher HIV risk. The same thing goes for heterosexual people and people who use drugs. So really those tend to be, of course, generalizing a little bit, the considerations taken when somebody's wanted to be on PrEP. Now, with COVID, that does change a little bit, right? Because what it has been the past 6 months, who has been able to go out and hook up a lot, right? It's been not the place or the time. But, you know, still some people, right, would hook up and that's okay. But providers and doctors, of course, will be taking that into account. Barry's asking if there are any age restrictions, recommendations, and who can and should access PrEP. Not necessarily. Canada is not very clear around that. The age of medical autonomy, you know, pretty much it does vary from province to province, and folks can access it as long as, you know, they have the ability to access those services, if that makes sense. So let's just say that it's still a little bit unclear, but there is no set age limit for who can be on PrEP. The reason why drug use is also explored is because it's also as a way for people to deal with taking PrEP, because it's really necessary that they take it consistently for PrEP to work. Sometimes folks that use drugs may forget or may need to make a specific plan to remember to take PrEP or to store it, depending on their housing situation as well. So that can also be a consideration for providers to support folks in those situations on how we can encourage and make sure that they can take the medication and store the medication safely. So while on PrEP, PrEP is sometimes folks are under the assumption that you just like go and get PrEP and you can get it in the same day, but usually there's a little bit of a process associated with it. So the process associated with being on PrEP is the following. Before you take PrEP, they're going to want to know a couple of things. So within your clinical assessment, they're going to ask you your sexual health history, drug use, behavior, all those things that we talked about. And they're going to recommend in order that you take some exams. So that's going to be urine and blood exams. So they're going to test you for STIs, HIV, and your kidney liver function to make sure that you're able to process PrEP in a safe way in your body. So once you do that initial test and it comes back all good, they're able to order the prescription for you. So once you get your prescription, they're going to ask you to repeat some of the testing after 1 month, specifically the HIV test and creatinine, which is the test for your kidney function. And then after the 1 month, you're just going to go back to getting tested every 3 months. And the 3-month tests are the complete tests where they are going to screen for STIs, HIV, and make sure that you're tolerating PrEP well in your body. So just to sum up, there's testing done before you start PrEP, 1 month after you're on PrEP, and then every 3 months after that. There's a question regarding blood donations while you're on PrEP, and you raise a really good point, which is the fact that Canada still unfortunately does have a ban on blood donations for men who have sex with men, requiring them to abstain from sex for a longer period of time than it's recommended for other populations. So usually, again, speaking generally, people on PrEP, because they qualify for PrEP and are high risk for HIV, they likely wouldn't be able to donate blood because of their sexual behavior. Again, that's because our government and Canadian Blood Services still screens based on identity when it comes to men who have sex with men, rather than screening people equally according to their risk behavior. So there's still a little bit of work to be done. They've improved quite a bit, but there's still some of that stigma out there that prevents a lot of queer and trans folks from donating blood. So really, the monitoring and follow-up for PrEP is to make sure that you remain HIV negative, make sure that you're screened and tested and treated for any STIs as soon as they come, and then to identify and monitor any PrEP impacts, and ask you too if you're having trouble taking the medication, how it's going for you, if it's still good for you, just kind of check in and touch base points. Another question was if PrEP prevents hepatitis B. The answer is no, the PrEP doesn't prevent hepatitis B, it just prevents HIV. But yeah, it's effective for HIV, but not for any other STI. Interactions. So when it comes to medications, usually there's some form of interaction, like you can take this, but you can't take that. But PrEP is really good with that. There's very few known interactions for people that are taking the medication. So specifically, that would test for, the interactions would be for recreational drugs. So, drugs that people use for fun or recreationally or to get high. They may just impact your adherence, so your ability to take it on a frequent basis. But it's not going to necessarily impact your health in terms of interacting with PrEP. It may also, some drugs tend to dehydrate people, and that's also something to be mindful of, especially on PrEP. PrEP is also safe to take during pregnancy. So to avoid vertical transmission from parent to child or through breastfeeding, folks can take PrEP and prevent that. And it's also safe to take during hormone therapy. There's no studies that show any negative relation between PrEP and any of their hormone therapies. Answering one of the questions as well in the chat, does the STI testing include oral and anal regions testing? That's really going to depend on the place that you get tested, honestly. Unfortunately, some places don't have that as a strong practice to do any swabs, but usually it only involves urine and blood. Those swabs are often done when there is anything symptomatic or when there is kind of suspicion of any other things happening. Again, it's kind of a localized thing that different labs and different testing centers have different um, standards for when to do anal, rectal, and oral swabs. So usually the PrEP regimens don't necessarily include those. But again, I would encourage folks to get and to advocate for them to get those swabs done, although they may be very uncomfortable. Unfortunately, they're very often overlooked by healthcare providers. Now, talking about interactions and how PrEP works, so there is some questions around side effects, right? Medication impacts our bodies, and it's very important for us to know how PrEP will impact our bodies. So it is generally very well tolerated in the body. So under 10% of those taking PrEP experience any form of short-term side effects. So those are effects that are going to just start right when you take the medication. So some people, though, under 10% of people may experience some level of nausea, vomiting, diarrhea, dizziness, or headaches. Again, that usually, tends to go away after a couple of days or after a week, and only happens to less than 10% of the patients. If, however, your symptoms are super extreme and don't go away, we really encourage you to speak to your provider and find out why that's the case. But with terms of long-term side effects, PrEP has been really linked to a decrease in kidney, liver, and bone health while people are taking the medication. So although they may be scary, those are some things that we test for before starting on PrEP. So we're going to ask you about any pre-existing conditions, and we're also going to be asking through those urine tests for your kidney and liver function to make sure that you can tolerate PrEP well. So again, although it's related to those decreases in health function, they don't have any impacts on your health, on your day-to-day life, unless you already have a condition related to that, if that makes sense. So they don't usually lead to any health complications, most of the cases. And if they do, that's something that we screen before. And when somebody does stop taking PrEP, right? PrEP's not necessarily something you take for your entire life, although that may be. When somebody stops taking PrEP after a couple of days or weeks, your levels of kidney, liver function, and bone health would go back to normal. I saw some new folks join in the call. Thanks everyone for coming in. I just want to remind everyone that the session is being recorded, and if you have any questions, feel free to pop them in the chat. I'll be looking at it throughout the presentation. So that's kind of it in terms of what PrEP is, how it works. Now we're going to talk a little bit more about how to get it. I work with Freddie, which is a new organization, and full disclosure, we're privately funded, and we're here to make LGBTQ2S+ PrEP access easier for you. So we understand that we're in a context in Canada that we can really reduce HIV rates and transmission if we make the prevention options that we have more accessible. So we want to make it such that if you're getting PrEP, you don't have to ask yourself if you're going to find, a homophobic or transphobic provider, if they're going to be racist, if they're going to be sex negative and just tell you to wear a condom, or if they're just going to know about PrEP at all. Well, unfortunately, a lot of doctors and providers in Canada don't know about PrEP and don't know updated information and evidence-based information about HIV. And still a lot of them carry a lot of stigma when it comes about sex. So we've had enough and we want to do something about it. And here's how to find PrEP through Freddie. We're currently open in Alberta, Saskatchewan, Ontario, Quebec, and Nova Scotia. We have programs that allow people to access it for free or cheaper in places that you might have to pay a copay. And we have a program also that offers 3 months of free PrEP as you're finding for financing alternatives. So that's just kind of overall. Step by step is that you'd go to our website, fill out a quick questionnaire, and schedule a consultation right away. The website has just been posted on the chat by Khaled. Thank you. So you choose your province. It should take you less than 5 minutes to fill that out. You create a login to a confidential and secure portal where all your information will be, and then you talk to one of our clinicians. All of them have been trained by me personally on LGBTQ2S+ health, PrEP, and sensitivity issues. And as soon as you sign up, you're going to be able to schedule an appointment with them. So we also are able to offer one-on-one individualized attention. So we have care coordinators that are going to follow up and remind you like, hey, your prescription will be running out, or it's time to do your 1 month test. It's time to do your 3 month test, so that PrEP can be as easy as it can and as fun as it should. So after the questionnaire, you visit a lab, and our providers will support you through finding a lab close to you, through like sending the prescription to requisition for testing there. They'll also send it to you, so you can really attend the testing anywhere that you prefer. Like you can attend it in places like Max, Axe in Toronto. You can attend them in places like Réseau, and we're able to work with those partners to make sure that we can still get you Freddie, delivering your PrEP. And then once all the results come back, you either can pick up PrEP at a pharmacy close to you, or you can get it delivered to your door for free by our pharmacy partners. So again, the PrEP would arrive confidentially in like a brown bag and nothing identifying that, hey, here's your Trombetta, here's your PrEP. It would be a confidential process, and we can get it delivered for free as well. I wanted to also touch base. This is also me, although from the photo shoot before. I want to offer some kind of information on our financial assistance programs. So I know that folks may be coming to this presentation from a whole bunch of different provinces. The programs that we have are in Alberta, it doesn't, and Saskatchewan, the system really, if you're clinically eligible for PrEP, you can get it for free through the public system. So we can provide it for free in those provinces, right? And Ontario and Quebec is a little bit more challenging because there usually is, if you're over 24 and need some level of insurance, there's usually some copay for PrEP. But we offer a financial assistance program in Ontario that makes it such that most of our patients pay $0. Or if they have to pay something, they're paying less than they normally would. And in Quebec, we're able to offer support with lab attendance. So we're able to, because Quebec has different laws regarding how much support we can get someone to be on the medication, that's not really allowed in Quebec. We can give support for people attending different labs as well, so that you'd still be able to access PrEP in a cheaper way. So again, I just wanted to highlight that anyone can access our website, anyone can access the PrEP kind of form. It does ask for some information, but if you don't want to give that information right away, like your healthcare card number, like information about your name, you can just put anything. Nothing stops you from having a consultation. At some point, we're going to need information like your name and date of birth for the testing and for the prescription. But really, like for folks who are refugee claimants, immigrants, and settlers whose English is not their first language and they prefer a different language, we'll bend over backwards and do our best to accommodate everyone's individual scenario. Like we've had scenarios where I've been there translating a session from to Spanish. So really our team is here to provide individual one-on-one access to PrEP. That's kind of what I had prepared in terms of what is PrEP, how PrEP works, how to access PrEP through Freddie. And I wanted to open it up for questions and also for George.
Thank you so much, Thomas, for the wonderful presentation. Now ask if you have got any questions. If you've got any question to ask Thomas in regards to PrEP, how we can access PrEP, any question that you have for Thomas in regards to this presentation, please feel free to unmute yourself, and or you can just put on you can just put on a chat. There's a question, I think. You can take that one on the chat.
Can people with no provincial health insurance card nor complementary insurance still access PrEP? That would be a little bit complicated depending on the province that you're in. That being said, there are ways in which we can offer assistance for folks to either apply through the Trillium program or for folks to access PrEP through some form of support. So again, that will depend on the province that you're in and how that will work in that province, but that wouldn't stop you from having a consultation with one of our providers, speaking about PrEP and having the team work hard on finding a way for you to access it. Also, now that we've opened in Quebec as well, we get a lot of questions regarding our services and being bilingual. We translate our website to French, um, and it's so you can access it all in French. And we have also made available clinical availability in French, of course, for folks in Quebec who speak French to be able to access, for them to be able to access services in French, the language. Um, there's another question here, if you can stop PrEP and start again. The answer is yes. So of course, it's always best if you stop PrEP with the not supervision, but with the support of a provider, so of a clinician or a healthcare provider, so that they can counsel you on the best date for you to stop PrEP. The only reason for that is so that they want to ensure that you are preventing HIV from the last exposure you had. So they may say like, hey, you just had sex this weekend, take PrEP until the end of the month, and then you're okay to stop. Not this weekend because it is the end of the month, but hypothetically, take PrEP for another month and then you're good to stop, just so that they make sure you're still preventing from your last exposure. And you can start PrEP again, of course. You just have to repeat the baseline exams to make sure you can still tolerate PrEP in your body and that you remain HIV negative. And the reason, just a little fun and curious fact, is that the reason why we need to ensure the most important thing for you to ensure that PrEP is safe for you is to make sure that you're HIV negative, is because the fact that the medication of PrEP is part of HIV medication makes it such that if an HIV positive person starts PrEP without knowing that they are HIV positive, they may build resistance to the components found in PrEP, because those components are not enough to treat an HIV infection and to reduce your viral load, but they're enough to prevent it in the first place. But if you are HIV positive, taking PrEP mistakenly, and you may build resistance to those components, which would make it such that you have to find an alternative treatment for HIV that does not have those components. That's okay. We have so many forms of treatment, especially in Canada for HIV, that's all right. But but it's sorry, I forgot my train of thought. There's many different kinds of HIV treatment around, so it's okay for folks if they need to find a different course. So, but that's why it's really important to make sure you're not HIV positive ahead of taking PrEP. There's a couple questions. Can you indicate that Freddie or like kind of queer-friendly doctors? So yes, through Freddie, all of our providers have been trained in LGBTQ2S plus health, acronyms, anti-oppression, and PrEP, so they know kind of what they're talking about. And I would encourage really folks to access providers that they know are LGBTQ2S plus friendly, just to avoid any awkward encounters, right? That folks may be sex negative, etc. So that's an option that we ensure that's the case of Freddie. What if both of you and your partner are on PrEP? Do you still need to use a condom? That depends, really. It depends on what kind of sex you're having, right? So if you and your partner are both on PrEP and you're in an open relationship, you may choose not to use a condom. That's everyone's choice, right? But at the end of the day, the PrEP will only be preventing HIV, and that person may be more vulnerable for STIs. But however, if you're in your PrEP, your partner are monogamous and are just using PrEP to prevent HIV transmission, let's say, between one person and the other, and just one of them is taking PrEP, and they're not worried about STIs, then PrEP would be enough for one person. But of course, the other person should still be on treatment. What if you're traveling outside of the country for more than 3 months? That's a very good question. In that case, it really is recommended that you speak to your provider about that. So they may be able to give you a larger amount of PrEP if they deem it to be the responsible thing and to be the thing that's safest for you to prevent HIV at that point of your life, right? However, somebody may not indicate if that's not their medical opinion. So really, if anyone is traveling outside of the country for more than 3 months, for more than what your PrEP supply allows, I would just really encourage you to tell that to your provider so that you can make arrangements that would allow you to continue taking PrEP while you're traveling. But we've seen that happen and it's possible. So, even folks in the military, right, they may be going to a place for a long time. Doctors and providers just really kind of weigh in the pros and the cons of giving them extra dose, not extra dose, but extra PrEP dose for that. What happens when you miss a day or two or a week? So again, that's something that we encourage you to speak to your provider about. If you miss a day or a dose, it's encouraged that you take it as soon as you can. But if it's been more than 12 hours of your missed dose, that you just forget about it and take it the next day. If you miss 2 days, you can still take it after, like 12 hours after, right? You just take your next dose. However, if you miss a week, that's something that's important to speak to your provider about, or to any care or your care coordinator, so that they can speak to you about what's the best way to restart on PrEP if you need to, wait a bit or retest, or also speak to you about ways in which you can ensure you are taking it more consistently, because there are some tips and trips that people can use to remember to take it every day. Of course, easier said than done, right? Folks living rough or houseless may have a harder time. If I were worried about my food security and my housing situation, HIV may not be the first priority on my mind. So really, it's just important to be transparent with your provider so that you can help each other finding what's the best alternative for you. The age limit for PrEP, in terms of a high age limit, it doesn't really exist. Depending on your age, if you are much, much older, right, you may have different comorbidities, that's what they call, with different conditions that may impact your PrEP, but it's still, you would be tested first. So, and having a transparent conversation would still allow it. We have patients that are older than 70 years old that are on PrEP. And in terms of limits to start PrEP, Canada is really not super clear about that. There is no specifications regarding you have to be so and such age to begin taking PrEP. I don't understand the other question if it's 18 years free.
Like access for free. Is it at what age they can access for free?
So in Ontario, for example, specifically in the province of Ontario, if you're under 24, PrEP is covered by the OHIP, Ontario Health Insurance Program. But if you're over 24 and you have to pay for some in Ontario, and you have to pay for some level of copay, Freddie is still able to take some of that copay and reduce it either to zero or a lower cost.
I have a question. Can you take PrEP without having a meal?
Without having what, sorry?
Without having a meal?
Yes, you can. PrEP doesn't necessarily cause an upset stomach if you haven't had meals. Of course, for people that experience nausea and stomach issues and upset stomachs, with more easiness, PrEP is recommended to take with a meal just so that it's best and has less of an impact for you. And it is also recommended to take with a meal because it allows people to remember to take PrEP more easily. However, it's not a condition on PrEP working or not working. Again, I would encourage folks, if you want to read some more as well, there's a lot of great links that Khaled has put on the chat, as well as the link to the Freddie questionnaire, which can get you started right away if that's something you're interested in, of course.
I also want to ask you if whilst you're bringing the questions, you can evaluate our program, this presentation as well on the chat. How you feel it went, or should we repeat again? I can just you can put any comments on the chat.
One thing too is that I like to bring up is that my role as a community manager is really to try to make sure we're always standing behind our mission of accessibility and community support. So if any of you run any groups, if any of you like to cross promote, if any of you like a presentation to chat more, or just to answer questions about Freddie, let me just put my information here. Here's my email. You can reach out to me personally, directly. We can chat about partnerships. I can answer any questions, really. That's what I'm here for. Yes, I can elaborate on the 1% exposure risk. That is because the medical system is very hesitant of making claims of 100% efficacy. There have been some cases in which people have gone from HIV negative to HIV positive while being on PrEP. Now, a couple of things to know about that is that number one, those cases have been overexposed in the media. It's kind of a way to generate fear, in my opinion. Number two, a lot of those cases involved somebody not taking PrEP constantly or not taking PrEP daily. And number three, the cases in which somebody became HIV positive while being on PrEP, as well as taking PrEP daily, have really been exceptions, like less than a handful of cases, because there was a very rare strain of HIV that that person encountered. And that strain of HIV was resistant to the components of PrEP. So again, that was a really rare encounter. It was kind of like the perfect storms in which a person was exposed to that HIV that was particularly resistant to the PrEP drugs. But again, out of tens of thousands of people that have been on PrEP and those who take it consistently, the exposure risk was, again, just very, very rare. So that's just to say that it works really well in real life settings, in terms of not only theoretically, right, how it would go about, but in real life population. So some questions around side effects. I'm just going to quickly go to the slide that we kind of cover a little bit of that. But again, only 10% of people on PrEP experience side effects in the short term. And those can be nausea, diarrhea, vomiting, headaches, but they tend to go away after a couple of days. And again, it's only less than 10% of the people that find them. For long-term side effects, a decrease in kidney function and bone health, but that doesn't cause anything bad unless you already have a condition, which we would have talked about in your consultation. And those also go away and go back to normal levels once somebody stops taking PrEP.
Also, just want to add that for folks that they cannot access PrEP at their homes, maybe they don't want to use the address to get PrEP or to order PrEP from GoFreddie, they can use Mark's office and they can collect it from us at Mark's office.
Yes, 100%. If you need translation services, if you have questions about coverage, if you need to talk about like anything specifically, really, and if you need like places to get it delivered, and like if you want to speak to us through also with somebody else, we're really to make our experience the best that it can be for you. So in your clinician conversation or in any email or like text, you can talk to us about those things and let us know ahead of time so that we come in prepared, you know, if it's translation needed, if it's concerns about delivery, etc. And yes, the comment on the chat is correct. Like it can cause symptoms that almost resemble the flu for lots of people. But again, most people don't experience any, but some people do. And if they persist, your side effects for PrEP, talk to your provider. But again, usually they go away after a couple of days. Again, anyone free to, thank you so much for the comments. You're all so kind. Thank you. And again, I'm going to put in my email here so that if you have any questions, want to partner, want to chat, have feedback, you can contact me directly or Max directly. And feel free to post any questions that you have on the chat. Khaled and George?
Yeah, I guess there's no more questions. Thank you very much, everyone, for tonight and attending to this question. Again, if there's any question or more, if you're having problem to access or to order PrEP, please don't hesitate to reach us at Max, or in fact, Max, you can check our website, GoFred as well, and they will be able to assist you. Thank you so much for participating tonight. presentation. Thank you.
Thank you, George, and thank you, Thomas, and thank you, everybody.
Thank you so much, everyone, for attending. Thanks for making time in this space. Have a good weekend and stay safe, whatever that means to you.